Good morning. Thank you for taking time to join us. The Survivorship and Palliative Care Task Force, in partnership with the Colorado Cancer Coalition and the Colorado Department of Public Health and Environment, is dedicated to promoting the cancer plan. And we, as a task force, have focused on mental health and palliative care. So we are thrilled today to have Melanie Stachelski
Yeah.
share her time and talents with us. She's with the Colorado Counseling, she's with Colorado Cancer Counseling. She is a cancer therapist, licensed professional counselor, and 14-year cancer survivor. That's fantastic. Melanie is a therapist at Colorado Cancer Counseling, where she specializes in supporting people through every stage of a cancer diagnosis. She has been working in the oncology field for the past decade, facilitating cancer support groups, teaching cancer skills classes, and providing counseling for individuals with cancer, as well as caregivers and family members. She is EMDR trained and a certified radical remission health coach. She's passionate about this work because she is a survivor herself. She was diagnosed with acute myeloid leukemia, AML, in 2009 and received a successful stem cell transplant in 2010. I will put her information in the chat so that you may connect with her. Melanie, thank you, and the floor is yours.
Thanks, Carlin. Okay, I'm going to share my screen. How does that look? Good? Okay. Well, welcome everyone. Thank you so much for coming on this beautiful day. I really appreciate you signing on to talk about mental health through the cancer journey. My name is Melanie Stachelski. I am a licensed professional counselor, and I have a counseling practice in Arvada, Colorado, where I specialize in supporting people's mental health through a cancer diagnosis. I absolutely love the work that I get to do, and it's very personal to me because I am a cancer survivor myself. This was me 14 years ago. I was diagnosed with AML, acute myeloid leukemia, in 2009, and I had an allogeneic stem cell transplant in 2010. So an allogeneic transplant is when you have someone else donate their stem cells to you. And I was lucky enough to actually get to meet my donor a few years ago. He was a 21-year-old young man from Germany. He skis in the Alps and he kite sails in the Black Sea, and he's just a lovely human being. And I wouldn't be alive today if it wasn't for him. This is also me. A couple of years after my transplant, I was battling graft versus host disease, which is a really common but brutal side effect of a stem cell transplant. So I've got the classic moon face here from the high doses of steroids I was taking. I was still going to so many doctor's appointments. I was probably taking about 20 pills a day to get through all of that. And then this is me today. 14 years after my cancer diagnosis, I am healthy, I am happy, and living a wonderful life as a mom, a wife, a cancer counselor, and so much more. And I wanted all of you to know that about me, because I want you to know that what I'm going to talk about today, it's not just something I read in a book. I actually do understand so much of what your patients are going through because I have also been there. So I have a lot of great information I want to share today. But the most important thing that I want you to hear is that I truly believe that there is a life worth fighting for after a cancer diagnosis. Now, depending on where someone is in their treatment and how they're feeling day to day, that might be hard for them to believe. But I believe that you can not only survive cancer, but you can thrive. That's been my personal experience as a 14-year cancer survivor, and the experience of so many people that I've met over the years. And that's why I love my work so much. So there is life after cancer, but in order to get there, there's a lot of really hard things that you have to navigate first. So I know everyone listening today would agree that the physical toll of cancer is enormous, but most people would also say that the mental and emotional part of cancer is equally as difficult. So today I'm going to tell you what I have learned from the past decade of being a cancer counselor and a lot of what I wish I would have known when I was going through treatment. I'm going to talk today about some of the common emotions and anxieties that people experience after being diagnosed with cancer and some of the coping strategies to get a better handle on those emotions. I'm going to talk about things like scanxiety and how people can manage it. And we'll talk about why survivorship is often so much harder than people expect it to be. There are also tons of valuable resources out there for getting more support on the cancer journey. So we're going to talk about lots of those throughout this presentation. And I'll leave time at the end for questions. So if you have any questions, I would love to hear them. And I'd also love to hear about what has been most helpful to your patients in supporting their mental health. So please plan to share those things at the end as well. When clients first come to me, they're usually feeling overwhelmed, anxious, and scared. And I think that they almost feel embarrassed that they're not handling their diagnosis better. So they'll tell me things like, I don't know what's wrong with me. If I was just mentally stronger, I could hold it together better. So I always start with them by saying that if you are struggling, you are not the only one. And if your anxiety feels out of control, you're not crazy. There is nothing wrong with you. Unfortunately, this roller coaster of emotions is just a very normal part of having cancer, but it's a part that we don't talk about very much. So first off, I'm going to tell you several things that I hear cancer survivors say a lot. I call this part of my presentation, I thought it was just me, because when I tell people some of these really common thoughts and feelings that cancer survivors have, they will often sigh with relief and say, oh, other people feel this way too. I thought it was just me. So I hope that some of these conversations today will really normalize what your patients are going through also. So here's the first thing that I hear people say a lot. I have an appointment coming up and I'm feeling really anxious. So I talked to a guy once that told me every few weeks he would wake up in the morning and his jaw would be aching and he could tell that he'd been grinding his teeth all night while he was sleeping. And it wouldn't be until later that day that he would realize that he had an oncology appointment coming up. So it was like his body started worrying about the doctor's appointment even before his mind was. In the days and weeks before someone's next blood test, scan, or bone marrow biopsy, even if it's a routine test that they have no reason to be concerned, people often experience increased anxiety, fear, trouble sleeping, and feelings of overwhelm and worry. They might notice their mind playing out every worst case scenario that might happen if the test results aren't good. So I'm wondering if any of that sounds familiar. This experience has actually been given a name and we call it scanxiety or test anxiety. And it's really common for people with cancer. So what can someone do when they're feeling scanxiety? The important thing to notice after a cancer diagnosis is that most of these overwhelming emotions happen because we are worrying about what might happen in the future. So these are all the what if questions. What if the treatment doesn't work? What if the side effects of the treatment are unbearable? Or what if my cancer comes back? These thoughts about the future cause a huge amount of stress. It's also common to spend a lot of time dwelling on the past, asking yourself, how did this happen? What did I do wrong? How did I get here? But the truth is that no amount of worrying will change the future, and no amount of regret will change the past. Instead, it keeps a person with cancer in a state of fear, stress, and anxiety, while they actually miss the good things that are happening right in front of them. Because here's the crazy thing about scanxiety and cancer. When you can stop yourself from worrying about what might happen in the future, what the next scan or blood test is going to say, and stop dwelling on the past, but instead bringing yourself into this moment right here, right now, most of the days in the present moment, most of the time things are okay. Most days are good days. None of those worst case scenarios from the future are happening right now. So this present moment right now is just all of us on this call today. So I want all of you to just stop right here for a minute, take a nice deep breath, and look around your room. Right here, everything is okay. This is a good moment. So when I talk about this to people with cancer, they start asking, okay, well, how exactly am I supposed to not worry about the future when I'm fighting for my life? It's easier said than done, right? Well, I'm going to teach you some really simple tools for doing that in just a few minutes. But first, I want to tell you a few more of those common worries that I hear from cancer survivors. So here's something that I hear from my clients a lot, and this one can feel really confusing. I should be happy that I'm finishing treatment, but instead I feel scared. So I once heard someone say that the two worst days for a cancer patient were, number one, the day they heard you have cancer, and number two was the day they heard you're done with treatment and you don't need to come back anymore. So at first glance, this sounds crazy, right? Why would finishing treatment feel emotionally difficult? Well, for someone who's used to being constantly monitored and rarely alone, this new freedom can make someone feel really vulnerable. They might find themselves wondering, but who will notice if my cancer comes back? And can I really trust that I'm okay? You're telling me okay, but can I really believe it? After months of treatment, the nurses and staff at someone's cancer center probably feels like family. So of course, they're glad to start spacing out their appointments, but it can also feel really lonely. They might miss seeing everyone. And most people will report that those friends that used to call and text all the time to check on them, they start to get back to their normal lives. It even feels like their family members are moving on. This is a phenomenon we call the treatment cliff, because people expect to be happy that they're finishing treatment, but it can end up feeling like all of their support is suddenly pulled out from under them and they're falling off that cliff. This is an experience that's really normal, but it catches people off guard. Here's another experience that can feel really confusing. I don't feel like celebrating yet. I hear people say something like, I finished chemo or finished my radiation and my family wants to throw me a big party. I can't explain it, but I just really don't feel like celebrating. In our society, we have a lot of expectations for what it looks like to be a cancer survivor. There seems to be an assumption that if you have cancer, you should run a race, start a charity, or start checking the big things off of your bucket list. There's a lot of pressure to be living life to the fullest every day. But I talk to a lot of people who are more reluctant to celebrate. Sometimes getting through cancer doesn't feel like a victory, and the patient does not feel like a hero. It just feels like something they had to endure because they had no other choice. And sometimes the idea of a celebration comes more from the people around them, who assume that the end of treatment means that everyone gets to close the door on that chapter of life called cancer, never think about it again, and things can finally get back to normal or back to how things were before the cancer diagnosis. This transition from being sick back to being healthy can be really difficult. There's a tension that exists here because a person is going back to the life that they once knew, but they probably don't feel like the same person that they were before. Again, all of this can feel really confusing. On one hand, of course, cancer patients are grateful to be getting through treatment, to be alive, and hopefully to be doing really well. But at the same time, most people also feel sad, angry, or just kind of numb and in shock. To make more sense of this, I think it's helpful to think of a cancer diagnosis as having some distinct phases. So the first phase of cancer starts on the left side of this picture with the shock and surprise of a cancer diagnosis. And that first phase includes treatment, so chemo, radiation, and surgery. During this first phase, people feel fearful, anxious, and worried. And the main goal here is just coping the best they can and getting through treatment. People tend to feel like they get tunnel vision, where they just put their head down, they focus on their treatment plan and the appointments that are right in front of them, and they don't really pick their head up to take in the bigger picture of what's happening. It's just too much and too scary. The second phase of a cancer diagnosis, that's the middle part of this chart, that happens after treatment is complete or when they move into a maintenance phase. So most people think that the chart should move up here, like people should be feeling really good, right? But you can see that my chart moves down in the middle. because this is actually a really hard time emotionally. This is the time when the dust starts to settle and the patient can finally look around and think, what did I just go through? This is the treatment cliff that I talked about earlier, when a lot of their support goes away and they're left trying to figure out how to be normal again and what life is supposed to look like now. The main goal of this middle phase is emotional processing. It's when someone really tries to take in all of what and make sense of what they've been through. So the major emotions that I see during this time is grief and loss. People experience a lot of grief for what they had to go through and what their bodies went through, and they feel the loss of what cancer has taken from them, because cancer takes so much from each of us. So this is obviously not a pleasant time, but it's one of the most important phases that I normalize for people, because it can be so confusing when someone is feeling that grief and loss, but everyone around them wants them to be happy and to start moving on. Here's a few other things I notice in this middle phase. People will say that their BS detector gets really sensitive, okay? So something that might have seemed really kind of mildly annoying before cancer now just feels unbearable. So like people complaining about petty things, activities or obligations that they just don't want to waste their time on anymore. Survivors can also feel kind of jealous of everyone around them that seems to get to live so carefree. They're making plans for the future, taking their health for granted, worrying about those petty things, and never even thinking that cancer is a possibility. One of my clients described survivorship like being on an alien planet. When you look around, everyone else seems to know how to be normal, and no one understands you or what you've just been through. I also see people in this middle phase really moderate their expectations for the future. It's hard to get excited about the future, or to put plans on the calendar, or to really let themselves get too happy, because being too happy or letting your guard down feels like tempting fate. Like the higher they would let themselves get, if something bad happens, then the further you have to fall. So it can just feel safer to keep your expectations low. So I hope that hearing about some of those experiences feels helpful, because if you're working with someone who's been thinking, I should be handling this better, or why am I not happier now? I want them to see that they will get there over to the right side of this graph, where they're feeling hopeful and confident. The right side is where someone feels like they're really thriving after cancer. But this middle part is just a very normal and expected part of cancer that unfortunately they have to go through first. So when I see first I see where my clients are on this graph, and then I start to think, okay, what do we do about it? I'm a very action-oriented therapist, so I think that talking about our feelings is great, but what do we do about it, right? What would actually be helpful to get through this better? So next, I'm going to teach you some of the really simple techniques for managing these emotions. If someone is still in active treatment, that's the first part of this graph. I think that the most helpful thing that they can learn is a practice we call mindfulness. Mindfulness is just ways of learning how to calm our bodies and calm our minds and live more in the present moment. So remember when I talked about scanxiety and cancer in general, that you'll notice that most of the hard emotions are triggered when you're worrying about the future, or when the future feels really uncertain. But when we can bring our minds back to the present moment, to what's happening right in front of us, most of the time things are actually okay. But we have to work at this, because being present is not a normal behavior for humans. This is one of my favorite cartoons. Are you mindful or mindful? So when the dog here is at the park with the beautiful trees and the sunshine, what is he thinking about? Well, he's thinking about the park with the beautiful trees and the sunshine. But the human at the park is thinking about work and bills. And if he's a cancer survivor, he's thinking about his next scan or what his doctor's going to say. We can get so consumed with our worries about cancer that we miss the good things that are happening right in front of us. So I teach my clients that when they find themselves worrying or feeling anxious about the future, when they're waiting for test results or waiting to see their doctor, to try a practice called mindful breathing. And I would love for all of you to practice this with me today. So if you're up for a little lunchtime relaxation, wherever you are, I'd love for you to just get comfortable in your seat. You can put your feet flat on the floor, rest your hands in your lap, and just start to take some deep breaths. You can close your eyes if that's comfortable, and just take those nice deep breaths. And as you're taking those deep breaths, I want you to turn your attention to your breathing as if you were a scientist who had never encountered breathing before. So be so curious about each movement and sensation in your body as you breathe. Notice what it feels like as the air comes into your mouth or nose and goes down to the bottom of your lungs, and feel it flow back out again. Notice the subtle rise and fall of your shoulders and the gentle rise and fall of your rib cage and abdomen. Notice the air moving in and out and how your breath feels slightly cooler as you inhale and slightly warmer as you exhale. And as you're doing those deep breaths, I want you to think of a word or a phrase that makes you feel calm and safe. So an example of a word could be peace or strength, or a phrase could be something like, everything is going to be okay. So choose something that makes you feel really calm. And I want you to just keep your attention here for maybe 3 more deep breaths, noticing all the sensations in your body as you breathe, and just repeating your word or phrase to yourself. So that technique is called mindful breathing. And the reason that this works is that the deep breathing physiologically calms you down and relaxes you. And focusing on the sensations of breathing and your word or phrase, you're focusing your mind out of the story that it was telling about the future and making yourself come back to the present moment, what your body feels like right now when you're taking those deep breaths. So if you're the kind of person who gets easily distracted, if that was hard for you, and if your mind keeps wandering, first of all, that's completely normal. That's the way our brains work. But you can try adding this next technique, which is called square breathing. So for this technique, I'd love for each of you to just look around the room where you're sitting and find a square in your room. So that could be a picture frame, a door, or a window. And you're going to trace the outline of the square with your finger. Each side of the square represents one in breath or one out breath. So as you trace the square, we're going to breathe in for a count of 4 and then breathe out for a count of 4. So take a few deep breaths with me here and I'll do the counting out loud. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. Breathe in, 2, 3, 4. Breathe out, 2, 3, 4. So that was 2 times around your square, breathing in and out. And something that my clients really like with this one is to replace the counting with a favorite mantra or affirmation. It could be the word or phrase that you used in the last exercise, and you would just repeat it 4 times to complete the square. So an example would be, everything is going to be okay. Everything is going to be okay. Everything is going to be okay. So again, you're getting that relaxation from that really deep breathing, but you're also giving your mind something to focus on. So that's one of my favorite ones for when someone's sitting in a doctor's office or feeling like that more acute stress, you're giving yourself something to think about, taking those really deep breaths. So the last one I want to teach you today is called a body scan. This is one I love for when you're falling asleep at night. When people are in a time of stress, like a cancer diagnosis, I think the worst times are when they're falling asleep, or maybe they wake up in the middle of the night and their mind is just going crazy. So I really love this one for going to sleep. The body scan that I use is cancer specific, but I would love for all of you again to just follow along and have that relaxation and just focus on kind of releasing some tension from your body today. So again, just bring your attention to your body in your chair. You can relax in your chair and just close your eyes if that's comfortable, or just have a gentle gaze. And start by taking some deep breaths. And for this one, I want you to picture a circle of healing white light directly above your head. This white light will enliven your body and infuse every cell with a vibrant healing energy. If there are any abnormal or cancerous cells present in your body, the healing white light will transform them into healthy cells. As you exhale, have a sense of releasing any toxins that are present in your body and feel yourself relaxing more deeply. Now watch as the light descends over the crown of your head and expands to circle around your head and face. Relax your forehead, relax your jaw, and let your facial muscles be soft. The light now moves down around your neck and throat. Let this area relax and soften. The light expands to envelop your upper back and shoulders. Take a nice deep breath here. See if you can relax any tension in your shoulders. Notice the light around your arms and hands. Are your hands tense or tight? See if you can allow them to soften. The light moves to surround your chest, back, and abdomen area. If you feel any tension or tightness, let it soften. Take a deep breath in and feel the white light infusing every cell with a vibrant healing energy. If there are any abnormal or cancerous cells present, the healing white light transforms them into healthy cells. As you exhale, any remaining toxins or abnormal cells are eliminated. Take a few more deep breaths and notice the light moving down around your thighs, knees, shins, and ankles. Notice any sensations in your legs and send the white light anywhere healing is needed here. The light moves down to surround your feet on the floor. Notice any sensations in your feet and feel the strength of the floor below you, pushing up and supporting you. And with the next inhale, watch as the white light expands to surround your entire body. Take one more deep breath, and as you exhale, release the white light from around your body and send with it any remaining tension or toxins. And when that feels complete, you can gently wiggle your fingers and your toes. And when you're ready, you can open your eyes and return to the room. So how does everyone feel after that? I am just trusting that everyone's still there. I really have no way of knowing if everyone's fallen asleep or walked away, but I hope that felt really nice and relaxing. I think in a cancer diagnosis, and really for anyone in that time of stress, we don't realize how tight we're holding our bodies. This one for me, I'm always so shocked at how tight my forehead is, or my jaw, how I'm clenching my jaw, or how I'm holding my fists. So just this is a nice time to just release that tension. And again, you're putting your attention towards that present moment and what your body feels like. So those mindfulness techniques, those are especially great for anyone who is still in active treatment. They can use them at any point in their day to calm their body and come back to the present moment, and just to ride out that roller coaster of emotions. If someone is finished with treatment or more in the maintenance phase, so that's the middle part of the graph I showed you, we really focus on processing what they've been through and healing from the trauma. Over the years, I have come to think of cancer as not just one trauma, but a series of traumatic events. So there are a few core components of how people heal from trauma that I feel like every person with cancer can benefit from. So I encourage my clients to think of ways that they can incorporate some of these into their life. So the first component of healing from trauma is letting go of the past, so that the memories of cancer don't hold so much intensity and emotion anymore. So I would expect a cancer survivor to always feel sad that they had to go through this. But over time, cancer should feel like a chapter of their story that is clearly in the past. So most of this will happen very naturally over time, but sometimes there will be parts of the cancer experience that still feel really intense when they think about them. So most people will say that there are certain places, sounds, smells, or even a commercial on TV that can bring back a flood of emotions and memories. So I talked to one woman who told me how she would race to turn off her microwave before the timer was finished because the sound of the alarm on her microwave reminded her of the beeping on her IV chemo pole. And she hated that sound and didn't want to hear it. Another man I talked to, he was months out from treatment, doing really well, and he wanted to go back and volunteer at his cancer center. So he drove down to the clinic, he took the elevator up to the infusion center, stepped off the elevator, and had a panic attack. And I'll tell you my personal experience with this. I was also several months out from treatment. I was doing really well, and I went to a yoga class. And in this yoga class, the instructor at one point told everyone, now I want everyone to just pay attention to your heart and honor your heart. And for some reason in that moment, I had this image of my central line, my port that was hooked up to all the medication I got, all the chemo, and how that was pumping all of those things through my heart. And I got so overwhelmed in that moment of the thought that everything my heart had been through during my cancer treatment, that in the middle of this yoga class, I just broke down and started to cry. So what is going on here? Well, there is more and more research showing that cancer survivors can have post-traumatic stress or PTSD. So most people associate PTSD with people who have seen combat in the military or experienced some other horrific event. We don't often give enough credit to how shocking, scary, and life-changing a cancer diagnosis can be. So those stories I told you are very common, but it's easy to feel kind of crazy when they happen. So instead, I tell my clients to just notice if something like that happens to them and to treat it with kindness instead of feeling crazy, and to acknowledge that they have indeed experienced and survived a trauma. When cancer survivors feel like they could use some additional support with this, it can be really helpful to have them talk to a therapist, a psychologist, or a social worker, ideally someone who is familiar with oncology. Most cancer clinics and hospitals have social workers or psychologists on staff that are available for people to talk to. I hope that some of those people are on the call today. These are our real superheroes in this work. So shout out to all the social workers and psychologists out there. Some clinics, they will also have a list of therapists in your community that they know and trust, and they can refer you to. And if someone is worried about the expense of therapy, I want you all to know that there are grants available to help pay for cancer counseling. I'm using a grant right now for some of my clients through the Ray of Hope Foundation. That's a Colorado nonprofit that is paying for some sessions with a cancer counselor. And if they're hoping to use their insurance to cover therapy, their insurance can most likely give them a list of their approved providers. And the resources here for cancer care and cancer support community, those are just a couple of the ways that patients can connect to a professional over the phone, online, or in person. And some of those resources are completely free. Another component of healing is to reconnect with your body. During cancer, it can feel like your body has betrayed you. So how can a cancer survivor begin to experience their body in a different way now, in a positive and friendly way? So this can be any modality that helps them pay attention to what's going on in their body. So something like yoga, Tai Chi, Reiki, massage, or a lot of my clients are really active. So it looks more like going for a walk or for a run, but really paying attention to how strong they feel when they're being active. So again, I want to expand this to everyone on the call today to just take a minute here to think about how you can begin to reconnect with your body. What is a practice that you enjoy that makes you feel really strong and healthy in your body? And the next component here is connection with others. So sometimes the best support that your patients can get is from someone else who's also been through this, someone who can tell them what their actual experience was like. Some organizations have programs that can match patients with another person, this peer support, who is around their same age with a similar diagnosis, a similar treatment plan, so people can talk one-on-one to find out what someone else's experience was like. A lot of people love the dynamic of a support group. A support group may be one of the only places in a cancer survivor's life where they can meet people who can truly say, I know what you're going through. The Colorado Cancer Coalition, they have one of my favorite resources for support groups. I use this all the time. It's on their website under the tab for patients and survivors. They have this huge Excel sheet of all the support groups from all over the state. So there are disease specific groups. There are educational groups for people who are interested in specific topics. So something like mindfulness or nutrition. There are support groups that are just for caregivers. There are online groups for people who live in remote areas or for people who prefer to interact online. And lastly, we are so lucky to live in Colorado. There is a really vibrant cancer community here. And there are so many wonderful community groups and nonprofits that get cancer survivors together for social outings, outdoor adventure, fitness, and other interests. I love these organizations because in these environments, because the conversation is not always about cancer, but again, you're with these other people who really understand what your experience has been. There's also a young adult community that has several great organizations. So that's just for the 18 to 40 age range. So whether it's with good friends, a support group, or a community organization, can you help your patients find a way to connect with other people who really understand their experience? The next component I already spoke about, and that's mindfulness. So when you're healing from the trauma of cancer, certain memories and reminders of your cancer can still be really disturbing. Cancer survivors can use these mindfulness techniques and those deep breaths to calm their bodies, calm their minds, and come back to the present moment where things are usually okay. So again, the ones that I taught you today is the mindful breathing, where you might take 10 slow, deep breaths, just noticing all the sensations in your body as you breathe. Square breathing, where you're finding that square, breathing in for 4 on the inhale and exhale, or repeating that positive phrase or mantra to yourself. Or a body scan, where you're drawing your attention to each part of your body, relaxing and releasing tension. There are also great mindfulness apps that you can download on your phone. Some of these even have cancer-specific programs, and most of them are free, and they're a great resource for people who are just starting out in kind of mindfulness or meditation. And the last component is self-compassion. Cancer survivors are pretty notorious for putting on a really brave face and making sure that everyone around them is okay. But I see every day how devastating a cancer diagnosis can be. And I see how hard they are on themselves when they don't feel positive or upbeat all the time. So if there are any survivors in our audience today, I want to tell you to remember to be kind to yourself. Healing and thriving is absolutely possible, but it takes time, more time than we want it to. It takes patience and a whole lot of self-compassion and kindness for yourself for everything that you've been through. And I want to end today with one last thing that I hear cancer survivors talk about a lot. And that is that going through cancer, it really stretches us and challenges us to be able to hold two opposite things at the same time. On one hand, most people will say that their cancer diagnosis was one of the worst experiences of their life. But cancer also has a way of highlighting what is truly important in life, and that can make life intensely vibrant and sacred. I heard someone say that life after cancer for her was like living in Technicolor. The grass had never been greener, the air fresher, or loved ones more cherished. The beauty in cancer comes from the increased urgency to pull what you love closer to you and to let go and leave behind what is no longer serving you. This journey through cancer is emotionally difficult and physically devastating, but there is a life worth fighting for after a cancer diagnosis. And if you are working with cancer survivors who don't feel like they're there yet, I hope that this presentation today has given you some more tools, resources, and insights that will help you to keep encouraging them to push them through all of those phases of cancer until they get to that other side where they feel like they're not only surviving, but truly thriving. So thank you for listening today. I'd love to take your questions at this point, or if anyone would love to share a technique or a resource that has helped your patients cope through their cancer journey, I'd love to hear that too. So I'll turn it back over to Carlin and the rest of the